we have Mark Siebert with us. And Mark is here with us at Aspen Grove Behavioral Hospital. He's a licensed clinical social worker, and he has a doctorate of organizational leadership. His counseling approach is focused around cognitive behavioral therapy, or CBT. He's also certified in DBT, which is dialectical behavior therapy as well. He specializes in treating adolescents and adults facing trauma, addiction, substance use. In fact, he's been working in mental health for approximately 26 years now. He's worked in acute inpatient and outpatient settings as well. And I'm really excited for this topic today that we're going to be discussing. So without further ado, I will turn the time over to Mark.
All right. Thank you. And thank you everyone for being here and taking time out. So I wanted to start out with showing a quick little 5-6 minute video. I'm sure some of you have seen it, maybe heard of it. It's Bob Newhart and his approach of just stop it. So I'm just going to pull that over here and watch this, and then we'll talk a little bit about it and also about pornography addiction. So,
Dr. Switzer?
Yes, come in. I just was washing my hands.
I'm Catherine Bigman. Janet Carlisle referred me.
Oh, yes. The line box.
Yes, that's me. Should I lay down?
Oh, no, we don't do that. Just have to. And let me tell you a bit about our billing. I charge $5 for the first 5 minutes, and then absolutely nothing after that. How does that sound?
That sounds great. Too good to be true, as a matter of fact.
Well, I can almost guarantee you that our session won't last the full 5 minutes. Now, we don't do any insurance billing, so you would either have to pay in cash or by check.
Wow. Okay.
And I don't make change.
All right.
Go. Tell me about the problem that you wish to address.
Oh, okay. Well, I had this fear of being buried alive in a box. I start thinking about being buried alive, and I begin to panic.
Has anyone ever tried to bury you alive in a box?
No, but truly thinking about it does make my life horrible. I mean, I can't go through tunnels or be in an elevator or in a house, anything boxy.
So what you're saying is you're claustrophobic.
Yes, that's it.
All right, well, let's go, Catherine. I'm going to say 2 words to you right now. I want you to listen to them very, very carefully. Then I want you to take them out of the office with you and incorporate them into your life.
Shall I write them down?
Well, if it makes you comfortable, it's just 2 words. Most people can remember them.
Okay.
You ready?
Yes.
Okay, you're there.
Stop it.
Yes. STOP, new word, IT.
So what are you saying?
You know, it's funny. I say 2 simple words, and I cannot tell you the amount of people who say exactly the same thing you're saying. I mean, this is not Yiddish, Catherine. This is English. Stop it.
So I should just stop it.
There you go. I mean, you don't want to go through life being scared of being buried alive in a box, do you? I mean, that sounds frightening. Stop it.
Kids, I mean, it's been with me since childhood.
No, we don't go there. Just stop.
So I should just stop being afraid of being buried alive in a box.
You got it. Good girl. Well, it's only been 3 minutes, so that will be $3.
I'm a
change.
Guess I'll take the full 5 minutes.
Fine. All right, well, what other problems would you like to address?
Oh, I'm bulimic. I stick my fingers down my throat.
Stop it! Sometimes they don't do that.
But I'm compelled to. My mom used to call me fatty.
No. No, we don't go there.
But I've been having this dream.
No, we don't go there either.
But my horoscope did say.
We definitely don't go there. Yes, stop it. What else?
Well, I have self-destructive relationships with men.
Stop it! You want to be with a man, don't you?
Yes.
Well, then stop it. Big date.
Push my hands a lot.
That's all right. Wash my hands all the time. There's a lot of germs. Yeah, don't worry about that.
I'm afraid to drive.
Well, stop it. Oh, you're gonna get around. Get in the car and drive, you kook.
Stop it. You stop it.
Okay.
I don't like this. I don't like this therapy at all. You're just telling me to stop it.
And you don't like that.
No, I don't.
So you think we're moving too fast, is that it?
Yes. Yes, I do.
All right, then let me give you 10 words that I think will clear everything up for you. You want to get a pad and a pencil for this one? Here are the 10 words. Stop it, or I'll bury you alive in a box.
So that's more of a comical approach to therapy. Obviously, that's not what we want to do, is shaming and those kind of things. But how many times have our clients come in feeling shame or been told by a loved one, partner, or whoever that it's just as simple as stopping the behavior? And so in regards to pornography addiction, there's still a lot of debate between whether it's an addiction, behavior, or compulsion. And so I've just included here some of the criteria from the DSM-5 in regards to substance abuse disorders and addictions. I know it's in the most recent research and studies I've been reading about is that they're looking at adding pornography, addiction or behavior into the DSM-6 when it comes out, as well as electronic addiction and a few other things they're going to add to it. But pornography is it's in that gray area of addiction in regards to, well, it's not really a substance, but it also elicits a chemical reaction in the brain. People can have withdrawals. People can, it interrupts their personal life, relationships, has negative impacts. And so just my hope today is just to kind of give some ideas and that you guys can use in working with clients that are suffering from pornography addiction. And so for the purposes of this presentation, I'm just going to use the word addiction moving forward, so there's not any kind of confusion with words. It's so as we know, pornography has been on the rise, especially with the increase of technology, as well as cell phones and access to internet. And so in 2019, one study found that 11% of men and 3% of women reported that they were addicted to pornography, and meaning an uncontrollable urge or compulsion to continue using it regardless of negative consequences. Online use has increased, and approximately 69% of American men and then 40% of American women have been viewing online pornography each year. It doesn't really specify the frequency or amount in these percentages, but just to give a little snapshot, In 2023, in 1 month alone, Pornhub had over 2 billion visits, considering the world population is about 8 billion. So it kind of gives you a number of how prevalent pornography is and its usage as being around the world. And here in the United States, about 57% of young adults between 18 to 25 are utilizing or viewing pornography monthly or more frequently. And then 29% of adults 25 and above are using it more frequently. And also, in regards to pornography, it's having a greater impact on relationships as well. Let's see, Paulson talked about how the quality and quantity of intimacy, relational satisfaction decreases if one or both partners are viewing pornography. And while there are still a few couples, or in my experience at least, that there are some that use pornography to help improve their sexual relational intimacy in their relationship. That's not the norm. So some of the stigmas that like Bob Newhart talked about in the video is stopping it. Do you want to be a bad person? Do you want to continue this behavior? What's wrong with you? And so if we're constantly bombarding these clients with the stigma that they're not good or they're socially unacceptable, they're already getting enough of that from people around them. And especially here in Utah, with the religious culture, the idea of needing to be perfect. I see a lot of clients from the LDS with religion, and it's a common misconception that they feel like they need to be perfect or they can't be a member of their church or can't have callings or those kind of things. And so I just really focus with clients in this area that it's not about perfection, it's about progression. And we're not going to be perfect in this life. Being perfect is unrealistic. It's an unrealistic expectation. So just helping clients understand that it's a process. And so other stigmas is that they live in a fantasy, that they self-isolate a lot, and then they feel unfit to be in a relationship, which then drives more loneliness. And then also with increased loneliness and increased pornography use, a lot of times increases depression and anxiety as well. And so the addiction it's a process, and a lot of times at least in my experience, I've never heard anyone come into my office and say, oh, today's the day I'm going to be addicted to pornography or to something else. It's very subtle. It really starts out very benign, accidentally seeing something across the screen or flash on your smartphone, and then it starts increasing curiosity. And as the chart here kind of shows, it moves upwards to where we can control it. Then it starts to become a problem, and then it turns into switches over to the addiction where it's daily use and it dominates life, and it starts falling into those categories as I mentioned about the DSM-5 classifications. And so, but the thing that makes pornography especially hard or difficult is that how it manipulates chemicals in the pleasure centers of the brain. And then over time, it causes repeated exposure. So we have that dopamine, serotonin dumps. And then afterwards, after viewing pornography or masturbation or anything like that, then you go into a depression or those kind of things. And so just to kind of remind people of the 4 addictions of pornography or of addiction in general is we have the craving or the intense desire, loss of control, where we feel that the addiction or the behavior is controlling us and we don't care about the negative consequences, the compulsion that we feel like we need to keep doing it or something's going to happen. And then again, negative consequences on our relationships, our work, our well-being, health. And so just like in all of the addictions, there's triggers. And so under helping clients understand what the triggers are, it's not so much coming into your office and and trying to figure out how to get over it. But you got to figure out what the triggers are, and it could be like boredom is the main trigger for majority of people for pornography addiction, anxiety, depression, loneliness, relationship issues, feeling rejected, those kind of things, feeling underappreciated. And then there's a lot of thinking errors that go into some of those triggers of justification or all or nothing mentality. So like thinking errors, like I've had a really rough day and I just need something to make me feel better. Viewing pornography does that, so I should be able to do that. But the idea is to identify what these triggers are, and not just identify the triggers, but what are they doing? And one trigger I didn't mention here is also related to trauma. Sometimes trauma can trigger that response of that desire to want to get rid of that negative feeling. So we do self-medication or self-medicating using pornography to get away from those negative thoughts, feelings, or emotions. And so, like an example, an emotional trigger is if we're walking down the street and you see a couple holding hands and you're like, hey, I wish I was in that situation. And then it starts triggering that idea of loneliness or rejection, or I'm by myself, or I'm not good enough. And then it leads to the ritual of, well, that isolation, just either being in your car or maybe going into a room and closing the door and then opening up your apps or whatever to utilize pornography. And then afterward, we feel guilt or shame for our behaviors. And so just in same ways or similar ways that we have a trauma response, our midbrain or our lizard brain wants to be in control. And so if I were to, with my hand, make a fist and have my thumb on the inside, with the thumb representing the midbrain and your fingers or fists representing your prefrontal cortex, which means that's where all your planning, your judgment, your reflection, organization, those kind of things all happen. But when we're triggered, something happens in our midbrain, takes over that chemical response, just like lights up like a switchboard, and it shoves the prefrontal cortex to the side, and we just want to meet whatever basic need. Like on Maslow's hierarchy of needs, we look at the very basics of food, water, shelter, and but that's what it drives on or thrives on. And so my hope today is to be able to talk about some ways to help bring back the prefrontal cortex, to bring it back into control and not allow the midbrain or the lizard brain to take over. And because if that happens, then go down the road of relapse. And so there's a lot of shame and guilt associated with pornography addiction. And so helping clients understand the difference is going to be key, because as we know, shame is I am the mistake, whereas guilt is more feeling the mistake. And when I meet with clients, as long as they can feel guilt, I see that as a good thing, because then guilt as a motivator can help them make those changes or make those adjustments that they're wanting to make in their lives to work towards sobriety. And then also just reminding clients that shame doesn't define them. In fact, it's in trying to identify other areas of their lives that they're doing really well with. This little picture here I have is usually how a client or someone who's suffering from addiction sees themselves. Whereas we see a person as 100%, but in actuality, their pornography addiction is only 1% of who they are or what they're made of. But all they see is the 99%. They invert that. And so all they see when they look in a mirror, or they judge themselves pretty harshly in regards to there's something wrong with themselves. What can we do? What can I do to change this? I'm never going to make anything. I'm never going to overcome this. And so they start catastrophizing. They make things bigger than what it really is. So as the clinician, trying to help them regain a sense of control and balance in their lives, helping them reclaim their worth and value, reinforce with the client that, like I said earlier, guilt is a good thing. And it's been my experience with when it comes to pornography addiction recovery, is to tell a client to stop cold turkey actually increases frequency and intensity, as well as anxiety, self-doubt, and other stressors or triggers like stress and those kind of things. So what I try to work with is really addressing with clients, instead of going cold turkey, to reduce the amount or the frequency. And so, for example, if I have a client that tells me, hey, Mark, I'm using pornography 5 times a day, I say, well, what can we do to get it down to 4 and do something different that 5th time? And so start by little things, start making a pathway and recreating some neural pathways. And I'll talk about neural pathways here in a little bit. But it's also kind of like if you compare someone who has a severe alcohol addiction, we don't want them to stop cold turkey, because if their alcohol addiction is severe enough that it could cause life-threatening seizures. So that's why we have them they work with their doctors to take benzodiazepines to help with those withdrawal symptoms in alcohol recovery. Telling ourselves to not use pornography just leads to increased use. So it's kind of like the brain is designed to be able to, or the way we think is more of, I'm not going to do something. Or think back when you guys were kids and your parents told you not to do something. What was the likelihood of you actually doing it? You'd think about it, maybe you didn't do it, but you usually had a thought like, oh, I want to do this, I want to try it out. So telling that someone who has an addiction, pornography addiction, to just stop or not do it actually causes more anxiety, which leads to more relapses. So I tend to tell clients to, instead of saying I can't do something, I can't view pornography, but I can do this, or I can't view pornography because I'm working on improving my relationship, I'm working on this particular goal. So it detracts from the actual acting out to achieving a different goal or a different mindset. And so the stages of change, I really like this model. In this particular demonstration here, or picture, they have relapse as right after maintenance. But I just want to make a note here that relapse can happen in any one of these stages. Most likely it happens between or after maintenance. However, there's a 7th stage that a lot of people don't talk about. It's the termination stage, and it's right. I didn't have time to put it over here, but the termination stage is this is the goal. This is what we want clients to obtain. We don't want them just maintaining for the rest of their lives. We want to give them a sense of hope that they can overcome this. And so it's not sufficient just to remain in maintenance, but to be free of it. So in order to be in this stage, in the termination stage, you need to usually be around 18 to 24 months of sobriety. And this means that you've learned that the client has learned the skills and the coping skills and tools to be able to maintain their sobriety moving forward, even if they're in the midst of, like a good example is, I had a client several months ago that he had been sober, or he'd been working with him for quite a while, but he'd been sober for about 16 months. He ended up going to a party, and unbeknownst to him, he did not know that they were having alcohol or serving alcohol. He told me, because Mark, I went and it wasn't a problem. I wasn't even tempted. I just had a different kind of drink and was able to move through. I wasn't triggered. And so it's about helping the client really understand what their triggers are, what their end goal is, and also just reinforcing with the client and giving that sense of hope that, yeah, they're going to make mistakes, they're going to screw up here and there, but instead of starting all the way over, you just back up and go back to the planning or preparation stage. and reevaluate what of their plan didn't work, what needs to be adjusted or whatever. And then you just restart from here, from the preparation, and go back into action and work towards maintenance. And so let's see. And so going back to this idea of this addiction causes neural pathways. Back in the 70s and 80s, there was the thought, and even before then, that if you're born with all the brain cells you're going to have, if you used any kind of drugs or anything like that, you would completely ruin your brain and it would never reheal, and you'd have problems for the rest of your life. But luckily, through technology and medicine and advancement in knowledge and research, we've learned that that's not the case, that the brain can actually heal itself. But it's going to take time, just like it took a little while and time to create and form the addiction. It's going to take time to reroute the brain. And so if you think of it, for those who like hiking, if you're going hiking and you find a trail that hasn't been used very much, it's very obscure, not very prominent. But the more you use it, the more prominent that trail becomes. And so another example of this, I call it blind driving, where you just get in your car and you go on autopilot because you've gone on so many of the same route. And so you have to do what's called a detour to kind of get out of that rut or that autopilot mode. And a lot of times our clients who have pornography addiction, they're literally driving blind. They're just going through the motions, just not really recognizing what's going on around them or inside of them. And then they come back and wonder why they've had a relapse. But just like our neural pathways, it starts out as a very subtle trail, and the more we use it, it becomes more prominent until it becomes a paved road and eventually a highway. And so when it becomes a highway, we're not thinking, we just have the thought, then we go right to the action without slowing anything down. And so the idea is to be able to help clients form what I call detours. So using their coping skills, using their goals that they're wanting to work on, helping them slow things down a little bit so they can not go from 0 to 60 so quickly and relapse. It's so there's a lot of different methods of addressing and treating pornography addiction. There, like was mentioned, I utilize a lot of CBT and DBT, but also for those who use solution-focused therapy, I find that that's been very helpful as well, to really focus on the client's strengths and what they bring to the table. Because when they come into my office, or when they come and see you, they already know what they want to do, but they may not know how to do it. So reinforcing that their strengths, reinforcing the idea that they have the ability to change, that they can overcome this. And I use an example a lot of, talking with clients about what difficult things they've already overcome in their lives, challenges, and viewing pornography as just another challenge, another roadblock that kind of give them that inner strength. But also, but I love solution focused, because I like using scales and being able to address what's working and what's not working. So if there are particular coping skill, let's say breathing exercises, that doesn't seem to help, then we look at other options and things for them to be able to do. One of the things, just like in chemical dependency, want to help the client recognize when they're leaning towards a relapse and getting out of the situation or moving themselves out of the environment. So I encourage clients to go for a walk, call a friend, do something that interrupts that thought, so then they can kind of, almost like the detour on the freeway, they take a different path. And so helping clients focus on the solution rather than the problem. Because so many times our clients come in and they're so focused on the problem that they can't see a way out. And so it's again about reinforcing what the clients already bring to the table, what their strengths are, and those kind of things. And then in a DBT model is using the wise mind. And a lot of times, especially when it comes with regards to pornography, is because it's an emotional response, but there's also helping clients recognize those thinking errors, the rational mind, and finding that balance. And so a lot of times it's a lot of trial and error, and getting to the wise mind takes practice and working with them, recognizing what their triggers are, what areas they may need to avoid out in public, or those kind of things. What kind of people are their support system, and that's going to be huge in the recovery process. Is pornography addiction. Is a lot of times clients don't tell others that they're struggling with this, and so I encourage and really try to help them reconnect into their support system, help them work through their shame and guilt by telling other people that they're struggling with this. And a lot of times it's they think that they're the only ones. And so just reinforcing with them that they're not the only ones struggling with this, that there's hundreds of people that are dealing with this, even within their own neighborhoods or even their wards or their church meetings or things like that. So helping them use past experience to overcome challenges, helping them use logic, and then also tying into their feelings. So I use the analogy, the example of I love Star Wars, and so hence I have the picture here of Anakin, who represents the emotional side. He functions on anger, reactionary, and whereas Obi-Wan is always telling him to mind his emotions, think logically, to shut himself off from that. But we can't keep doing that. We can't be in one foot and or we can't be in either one all the time. So we've got to be like Yoda. We've got to be in that wise mind where we're using both our rational mind and our emotional mind. Think back in your own lives when you've done something or you're in the process of doing something, and that little voice in your head or whatever says, "Hey, I probably shouldn't be doing this," but you do it anyway, and then there's a consequence. I remember years ago, I went with some friends of mine, and we went off-roading, and we decided to go at like 1 a.m, so definitely dark, couldn't really see a whole lot. And unfortunately, my friend, we're going up this hill, and I had this thought or this idea that we shouldn't be doing this, and I put it to the side because the feeling of excitement and adventure was overwhelming or overpowering. And we just kept going, and we ended up rolling down a ravine and totaling the car and being stranded out in the middle of nowhere. And so I look back at that example, and I think if I would have used a practice wise mind, might have been able to avoid that situation. And so again, a combination of different modalities. It doesn't have to be just one CBT or anything like that, but I think a combination between CBT, solution focused, and DBT can help clients recognize and have a wider range of tools and coping skills to manage the addiction and get it under control. And then again, the ABC model in CBT. So we have the triggering event, the triggering event. And a lot of times our clients, they go right from the trigger right to the acting out and the consequence, the feelings and behaviors. And they're not stopping in between to figure out what that belief is. So like my previous example of the person walking down the street and sees a couple and he wants to be in a relationship, or they want to be in a relationship, and they automatically decide I'm not feeling good, or I'm feeling bad about myself, and so they revert to the pornography use. but we need to slow down and really identify what those beliefs are. Is it the belief of, oh, I'm not good enough, or I'm not, or am I not attractive, or whatever that belief is that's causing them to want to go down that path, and changing that. And then finally, one of my favorite things to do with clients is to identify their values. And the top line with the arrow represents a value. It doesn't change it. And so like think of it a value in your own life, whether that be integrity, or in our cases, with our clients, about sobriety. They value sobriety. They want to be sober. However, and the squiggly lines underneath represent behavior. So sometimes our behaviors change. The value doesn't change, but our behavior does. And sometimes our behavior brings us closer in alignment with our value, and sometimes our behavior takes us farther away from our value. And every dip that you see here represents like a relapse. And so it's about helping clients realign their value with their behavior. And as you can see here, as they start doing that and applying those principles and those coping skills and strategies, the dips start slow ironing out and become straighter, and it becomes more aligned with the value. And this then over time then becomes turns into that termination stage of the change model, the goal that we want them to get to. And so, but I just want you to guys, I just want you guys to think of something that you need to change or you'd like to change in your life. What's kept you from doing that? These are the same questions that our clients have of, I want to change, but what am I willing to change, or what am I willing to do? And so reminding clients that it's not a race, it's not, you got to get through it as quick as possible, but it's going to take time. It's going to take patience and effort. Um, and so addiction, like I said, is not a race. It's a progression of change, and the addict can change and become a better, stronger version of themselves over time. And the other thing I like about solution focused therapy is that you're seeing the client for who they are, not what they are. And so you see the inner potential, you try to bring that out in them, or help them see something that they can't see in themselves. And one of the things I also use with clients is I'll have a mirror in my office, and I'll ask them, what do they see? And if they can't see anything, then I help them. I identify some of their strengths and abilities. And then I'll have them do that every morning as a mantra. What do you see? And if they're struggling with that, have them reach out to their support network. Have them identify some of the strengths in themselves that they're not seeing. And as clinicians, we ask clients to change. And again, what are we willing to change? What are we willing to do? So it's one thing to tell a client to stop it. That's one thing to tell a client that they can overcome this. But I think meeting them on their level uh, will help in regards to that road to recovery. And there is so much research in regards to pornography. And unfortunately, pornography is not something that's going to go away. It's getting more and more prevalent. Um, I'm trying to remember, it was a Harvard article I was just reading a little while ago, but they were talking about how pornography is getting inundated, or even in elementary schools, our youth, our children as young as age 8 to 9 are being exposed to pornography. Now, I'm not saying that everyone who views pornography is going to turn out to have an addiction, just like any people who drink alcohol socially don't turn out to be alcoholics. But it's a gradual process. It's subtle. It doesn't, and this is where the pornography is, I think, is a bigger challenge, because unlike some of the chemical drugs and things like that, it's hard to separate yourself from your mind. No matter how far you go, you're always going to be with your mind. And so it's about restructuring those neural pathways. What is the pornography addressing? What the pornography is doing? What need is it masking? Just like with alcohol or marijuana, a lot of clients are self-medicating. what is the hurt? What is the underlying driver for them to continue to use pornography from day to day, and then align what it is they want to accomplish, and make a plan. And also just remind clients it's okay to have a relapse. I'd rather have a client come into my office and say, hey, Mark, I had 5 relapses or whatever this past week, because then that's something that's a baseline. We can look at what happened, what led up to those relapses. Was it stress? Was it relationships? Was it anything else, or was it something completely out of the blue? And start really addressing what's happening with that. And so again, as clinicians, and we're promoters of change, and I am a strong believer that we, as Gandhi states, we want to be the change we want to see in the world. So giving those clients that hope that they can overcome. And the tricky thing about pornography addiction is there is, as you all know, there is no test that you can't give someone a breathalyzer. You can't test them like a blood test to see if they're using pornography. But you can use some of the biometrics like um, sorry, like their stress levels. How are they feeling during leading up to a relapse? Their heart rate, what's going on around them, and just that DBT model of really addressing those underlying emotions that are driving it. And so, but the other thing, again, to not sound like a broken record, but helping them connect into their social network or their support system. Also helping them identify the people that aren't good or those toxic relationships, and moving them out of the picture so they can move forward in their addiction or their addiction recovery. And so I also just wanted to just wrap up with show, these are some videos that I have all my clients watch, and then come back and we talk about it. If you guys haven't seen them, but Johan Hari and Everything You Think You Know About Addiction Is Wrong is about his study that he did in regards to the old model of recovery, which was about shame and guilt and isolation. Like, you go take care of your problem and then come back and when you fixed it. But he gives a really good analogy of how to overcome addiction. And then Gabor Mate, he's he's the #1 leading psychiatrist in um, Canada. He's from Portugal, but he leads the addiction recovery in Canada. And his video on addiction, the power of addiction, is a really good one to watch or have your clients watch. And then finally, Hooked, Hijacked, and Hacked, Reclaim Your Brain from Addictive Living. There are a lot of different videos, but these are the ones I mainly stick with and work with clients in regards to helping them see from a different perspective of what addiction recovery looks like and how they can overcome that. And so, but um, we are at the end, but just wanted to, I know I went through it pretty quickly, but I'm willing to answer any questions. And if we can't get to your questions, I'll have my email posted, and you can reach out to me that way as well.
So we had the first question from Spencer, who wanted to know a little bit, and just off the top of your head, Mark, do you know if there are any studies out there about the efficacy of couples viewing pornography together to help them with sexual issues? Spencer says that he advises against it with couples, but he has heard of some people getting that counsel from therapists. So we just wanted to know, has anything been published on that?
I'm not aware anything as a moment, but I've heard similar things where clients or couples have come in and said a previous therapist recommended this, but I think it's more about where's their relationship and what's it doing? Why would they recommend that? So I think looking at the underlying reason of why that was being recommended, I think would better understand you as a therapist to be able to help the couple or the client.
Great advice. Thank you. I also like Rachel's comment here. She dropped this in the chat earlier. the quote, "Be ye therefore perfect," would be more accurately translated from the Greek as "stand at the gate and await my command." That's pretty
Yeah,
profound.
love that.
Thanks for sharing that, Rachel. Also, John had a comment. He said earlier that he's heard the term trigger can be triggering for a few with trauma issues, and
Yeah.
some are now actually preferring the word cues instead. That was very insightful too, I thought. Let's see. I'm trying to see if I know there's a few more here. I know Erin said she likes the idea of providing an interrupting detour and solutions based versus problem focuses, or I guess, yeah, I think that's what she's saying, solution based versus problem. That's a great comment as well. Um, Someone else said caterpillar slash butterfly. It's all about the perspective, the transformation. That was really good too. And then Kimberly has a question. Can you speak more about elementary age pornography use? She says she's seeing some K through 6 kids with this drive to get their hands on technology specifically to view pornography. Can you maybe talk a little bit about that? What we're seeing maybe in terms of trends?
Yeah, just in regards to that, it's just something to be mindful of with the advent of technology, and we're giving kids phones at younger ages. And so it's and it's almost kind of like if back in I remember the 90s when uh, I'm trying to remember which drug it was, but it came in like it looked like Fred Flintstone vitamins, and it was just very eye-catching, very benign, but it had a pretty drastic effect. So I think in regards, I don't have the specifics on numbers in regards to elementary, but it's just getting more and more. But I think it's more about educating parents and letting them know of what the dangers are, and being able to track and be more involved in their kids and what they're actually doing, because there are apps and things that parents can put on to block certain things, or they can get an update. They get a notice. I use a 360 on my phone with my kids, so anything that they're accessing, I get a little update, or I get a notification if it's something they shouldn't be. But again, especially with little kids, we got to be mindful not to do the shaming, but it's more about why are you looking at this? Who's telling you, and what's the message that they're trying to get? So again, even with little kids, we want to be mindful of that shaming that knee-jerk reaction as parents we tend to do.
That's really great advice. Thanks, Mark. Yeah, and John says he thinks that the drug that we were referring to earlier was spice. Does that sound familiar, maybe?
Yeah. Yep.
Okay. And then EJ says, if I'm working with a teen who stopped cold turkey last week before telling me about his addiction, how do I handle that? I don't necessarily want to encourage them to start watching again, but also don't want them to feel bad if they relapse.
Yeah. So first and foremost, ask them like, what was that final straw or whatever that caused them to not look, or go cold turkey? Is it because dad said, hey, I'm not going to let you have your phone unless you do this, that underlying reason? But then also processing with them, how has your anxiety been over this past week? What does that look like? What's the extent of their addiction before going cold turkey? Or some things you're going to want to look at. Also, what is it a group that he's involved with, or whatever? Like, so what are the underlying motivators? How's he dealing with the anxiety? And then who's his support people? Who's the people he's going to get extra help and support? Because for teenagers, that's a big ask to not be looking at that. And again, I'm not encouraging that clients look at pornography or those kind of things. It's more focus of how to decrease it over time so it's not so stressful.
Great advice. And Kansas is asking, how do we normalize some porn viewing to 18 to 22-year-olds, typically LDS males, who might come into an emergency department frequently for SI due to feeling that they are an addict for occasional viewing and masturbation?
You go through, like, For me, I'll actually go over the criteria for addiction and discuss with them, well, it doesn't really seem like it's an addiction. It's more of back on my slide where it's in that triangle I had, more of curiosity or moderate use. And so what are they using it for? What is it? What is its purpose? Again, especially with the LDS culture, why are you in my office? Not again, not the shaming, but what is your ultimate goal? So again, not focusing on the addiction, but focusing on the solution of, okay, well, you're here in my office. Obviously, you want to get help. What can we do to decrease that? So again, really defining the shame and differentiating that from guilt. And then if needed, reach out. If you like, I've even sat with some of my clients and had them call or reach out to someone they haven't told that they've got an addiction, or have them invite their spouse or their best friend or whoever into the next session, so we can talk about those things, so they can understand, so their friends understand what those triggers are and things, so they can get that help as well.
Dustin is asking if you can share about your success rates, like how many make it to the termination stage?
I would say over my career, probably around, I would say 75, 80%. Usually I have to admit though, I normally only see clients for about between 6 to 8 months, but I do have a lot of clients that will reach back out and give me an update or let me know how they're doing, or they'll just come in for a check-in, follow-up therapy or whatever. But on average, I'm about 75, 80% to that termination stage by doing some of these things I've talked about.
Delphina is asking if there is a difference in rural areas with porn addiction. I think she's meaning, like, is there a difference between rural areas versus urban cities, things like that?
That is a great question, and unfortunately, I don't have an answer. I haven't worked too much in the rural areas, so I don't know about that.
Okay. Brooke asks, do you recommend similar treatment methods for child pornography addiction? Like, do you distinguish? And
You mean the client has a child
right,
pornography
I
addiction?
think she's Brooke's asking, like, on the material that's being viewed, like, do you treat someone who's viewing maybe child pornography different than adult pornography?
Yes and no, because there's obviously, because there when it comes to child pornography, there's laws that have to be maintained. You have to report, um, and it could lead to other things. Not that we don't want them reporting, but it's there's when it comes to child pornography, there's something that's happened in their past in regards to some trauma or abuse, that because my experience has been clients who have been sexually abused, and I'm not saying this for all clients, but some clients who've been sexually abused become the offenders. So I think looking at that, and really you're gonna have to peel back the onion on that one, and use your judgment of when you need to call and report um, to the local authorities as well.
Great. Rachel asks, is the main reason why you should increase clients' social supports because pornography use thrives in secrecy?
Yes, because one of the founding things or basic principles of pornography addiction is about disconnection. Most people, they're not viewing pornography out in public. They're not viewing it with their friends. They're doing it in secret. They're doing it behind closed doors. So the idea of them connecting back into a support system so they don't feel that weight of isolation, because increased isolation increases depression and anxiety, and increased depression and anxiety can lead to increased suicidal thoughts and those things.
Those were all great questions. Does anyone else have a question for Mark? It looks like, uh, let's see, Joseph does. He's asking, Mark, what are your thoughts about 12-step support groups?
Um, it's a mixed bag. Well, it depends. I know with the LDS Church, they do an ARP group. However, and those run off of 12-step, but I've run some of those groups, but the issue I've had with them is that there isn't enough crosstalk, there isn't enough interpersonal relationship building. I do run a men's pornography group through LDS Family Services once a week, and it's a closed group. So we do a little bit of the 12 steps, but it's more about helping the clients connect with each other and about creating that support network. Obviously tapping into a higher power, tapping into those steps and things, but I really think that those closed groups, 12 steps has its place, but I think if they can get to a closed group where they can have more interaction, more dialogue, more discussion, and more safety, I guess would be the word, get a lot better result.
Great. Yeah, John has a comment here. I've heard it said our secrets keep us sick. Demonstrates the importance of community and connection in healing and relapse prevention. And here's another question. Is that group open? Can we refer people to the group, or where do we get the info if it is open?
With the LDS Family Services, the client has to be referred by their bishop, and then someone at LDS Family Services will reach out to them, do an assessment, and see if that group is something that they would be interested in doing, and then they get them set up with that.
Good. Here's another question. Rachel says, how would you separate porn use versus masturbation? They may or may not go together.
Again, it's the underlying what's leading to what. Why are they doing the behavior? What is the masturbation doing to enhance the pornography experience, or what that sexual release, I guess you could call it. But it's been at least my experience, most people who are using pornography are also involved in masturbation. So it's two behaviors that they're wanting to overcome. So reducing the pornography reduces their masturbation.
All right. Well, if there are no other questions for Mark, I want to thank everyone for being here today, and especially for Mark for taking time out of his busy schedule to be with us and to impart his knowledge over the 26 years that he's been working in these type of situations. It's been very, very informative, very educational. Thank you, Mark.
Thank you.
All right, everyone. We try to do these a couple times every month. We generally try to meet on the second and fourth Tuesday of each month. So watch for an email with upcoming CEs. And again, if anyone has any problem accessing the evaluation, please reach out to me. I'm happy to help troubleshoot any issues that you might be running into. Otherwise, thank you everyone for being here, and I wish you a happy day. Enjoy the rest of your week.